Welcome to Doctors on Call. I'm Jenna Miller. The new coronavirus has now infected 1 million people across the world. As of this week, there have been over 380,000 cases in the United States, leading to more than 12,000 deaths. Right here in Kansas, the numbers have gradually increased to more than 900 cases and 27 deaths. Will the pandemic spread to rural America? What can we do to prepare? We'll tackle these issues and more on Doctors on Call with our guest, family physician, Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. At Blue Cross and Blue Shield of Kansas, we're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrel Summers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are now open at 800-337-4788, toll free if you have any questions regarding the coronavirus on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us tonight to discuss this topic that is really on everybody's discussion list. First of all, let's talk about what are the symptoms of coronavirus.
So it's a very interesting thing. Coronavirus kind of, for the majority of people, is a pretty mild presentation. What we see primarily is people have fevers, they'll have a little bit of a cough that could be productive, may not be productive, and then they might have a little bit of shortness of breath. For the majority of people, that's really it. It kind of acts like a common cold, something that you would call like a viral type of bronchitis. Some people don't even have that much symptoms. They might have a little bit of a minimal cough or a runny nose or a sore throat. In people who have underlying immunocompromised states or are very deconditioned medically, though, it can progress into a form of a pneumonia that could go into a form of respiratory failure that can be deadly. That's why the big concern has been about the coronavirus recently.
Now, if somebody has any or all of those symptoms, probably not all of them, how important is it to it? Is it absolutely necessary that they go in and get tested? Should they just stay home? What's your take on that?
That's a great question. Specifically, people who have the symptoms, who are at higher risk, should definitely be tested. What I mean by that is anybody who's over the age of about 60, or if they have an underlying chronic medical condition such as diabetes, high blood pressure, congestive heart failure, really anything in which they see a doctor for on a regular basis, they should probably be seen and be tested to be sure that they don't have coronavirus. Now, if you're a general member of the public who's in relatively good health and you start to have some symptoms and you're worried or concerned about that, you can definitely be tested, but you don't absolutely have to be tested in those situations.
Now, we're hearing a lot about people testing, either positive or negative. I'm not hearing a lot about the treatment. Let's discuss what treatment we're looking at if somebody does have a positive test.
And so for the majority of individuals that are having the minimal kind of symptoms, really over-the-counter treatment is all we recommend. And so if you take something regularly for cough that kind of helps over-the-counter, do that. If you take something that helps kind of with your congestion, that's a good thing to be on as well. If you have underlying asthma and you need medications for control of your asthma, continue those medications as regularly. When we get into hospitalization, that's kind of when advanced treatments come into effect. For the majority of people, oxygen is really helpful. Some people might need ventilator care or even more critical care. Other individuals can go into different types of organ failure even and need like medications via intravenous. They might need intravenous antibiotics for a number of different reasons.
Is it true that some patients may not show any symptoms at all?
Yeah, we've had a large number of people that we're calling asymptomatic carriers. They're basically individuals who walk around, they might have mild sniffles, which honestly right now a lot of people with the allergy season going on right now have mild congestion and probably don't even know it. those types of people could also have coronavirus possibly and could be spreading it without even knowing. Those especially that are in the younger age ranges, like in their 20s and 30s, they might not really notice any symptoms other than just a minor cold, which normally is just a minimal inconvenience to them.
Now, is that the reason why we've had all these stay-at-home orders?
Yeah, that's exactly what it's been. What we're trying to do right now is trying to minimize the number of people that would get the severe type of infections and end up overwhelming the hospital system. As it stands right now, we have a pretty slowed down rate of individuals that are coming into the hospital to be evaluated, and that's been a very good thing. What we don't want to see is we don't want to see a massive influx of people who are very, very chronically ill and sick, because that could overwhelm our ICU, it could overwhelm our ventilator sources, and if that occurs, we'd have to make bad decisions when it comes to who would live and who would die. And how we would manage those type of resources. So by staying home, by minimizing the distance between people, by doing like social distancing, doing the things that you need to do, that minimizes that risk.
Excellent. We might talk a little bit more about that later. Right now we've got a phone call or a person waiting to ask a question for Dr. Summers. We'll just take the call right now. This is Melanie from Chapman. Hi, Melanie. Do you have a question for Dr. Summers?
Yes, I do. I was just kind of curious as to why this specific virus is so much worse than, say, for example, the flu. You see the results of there's been over 100,000 deaths worldwide so far this year from the flu, or even, say, the swine flu from, years ago. Why is this one so much worse and getting so much more attention?
Thank you for your question. That's a wonderful question to ask. What I would say is that this, compared to regular influenza, is a little bit different in its infectivity. And so if you look at how quickly it can spread and how fast it can spread, it's a lot more different than influenza. Now, influenza is definitely a very, very prominent virus and definitely can cause a lot of harm to people in our nation. One thing that's a benefit to us in influenza, though, is that we do have medications directly against influenza, something we don't have for the coronavirus quite yet. The other thing, too, is we have yearly immunizations against influenza, which helps reduce that risk of people dying and people having severe complications from influenza specifically. Now, coronavirus, we are working towards a vaccine, but we don't know how long that's going to be until we have one. There are some medications that you might hear anecdotally that we use for people. Those are really people who have severe symptoms who are on like ICU level of care. For just the general population, we don't have those medications available quite yet. And so it's one of those things where we have a little bit more things that can prepare and fight against influenza as compared to the coronavirus. And the coronavirus also is much quicker in its infectivity. It can spread a lot more quicker.
Let's talk about the recovery rate compared to the mortality rate regarding the coronavirus.
Yeah, so the recovery rate for the majority of individuals is pretty well. Just like any other common cold, which the coronavirus is very much one of the common viruses that cause the common cold, people can recover from it. It's pretty easy to do for most people. The problem becomes, again, those people that are in very severe kind of medical conditions, they're the ones that are going to have the highest complication rate. We've noticed that individuals that come in with those types of complications have about a 70% chance of being hospitalized. Those that come in with a severe infection that requires ICU level care, they have about a 50% mortality rate, which means a flip of a coin, heads or tails, they could pass away because of it. It's a very severe, very deadly disease for those people who have those medical conditions.
We were talking about the symptoms a little while ago. The loss of smell and taste. We've heard that one. Is there any truth behind that symptom?
So again, everyone experiences symptoms differently. So for some people, they'll get the cough. Some people, they get the hallmark fever. Some people don't. Anecdotally, there have been some people who say that they don't have the sensation of smell, the sensation of taste. We look at the CDC and also our records on exactly what the presentation commonly is. That's really not something that's seen commonly, though.
What about your opinion regarding the virus becoming widespread in this in this area?
So as it stands right now, we've been lucky in that Western Kansas specifically has had very minimal number of cases, and the majority of the cases that we've seen in Western Kansas have been spread because of traveling, meaning a person traveled either from an endemic area, someone came back from Kansas City where they're seeing a large number of cases, and they picked it up. We haven't really seen what's known as community spread. Community spread just basically means that any time that you're walking outwards within the community, you can pick it up from somebody else. And that hasn't been the case. And that's been because we have wonderful public health servants that are identifying those individuals quickly and then quarantining them and keeping them away from other people to prevent that kind of a spread. Without our stay-at-home orders, without these quarantines, we could easily see a very quick progressive spread of this virus, and it could become even worse for our healthcare system.
Now, I think the CDC first came out and they said only people who actually had the virus needed to wear a mask. Now they've kind of changed that and said that they think, if you want, it can help to, prevent it. What is your opinion on wearing a mask, whether you're healthy or not?
Sure. I would say that wearing a mask, if it makes you feel comfortable, is completely safe and all right. There's no reason why you shouldn't be able to wear a mask if you're worried about catching an infection from somebody else. And that's true even when it's flu season, to be honest with you, Jenna. One of the things that I will tell you is this, though. If there are specific masks that are medical grade masks that are made for medical personnel, I would say please try to limit your use of those so that medical personnel can get a hold of that equipment so that they can kind of reduce their risk from exposures. We're out here on the front lines helping people out, and without that protective equipment, we can be at really high risk for catching the virus ourselves. When you have a sick doctor, you have a sick nurse, you have a sick person who's doing registration, it shuts down hospital systems. It can make them go much slower and kind of reduce the care that we give patients. So if you want to have a mask that's just like a regular grade mask or one that's made from cloth, please do so to keep yourself comfortable. That'd be great, but leave the medical grade devices for those that need it in the medical field.
Excellent information. Should the pandemic spread further into Kansas, do you believe there are enough ventilators to provided?
Yeah, we actually had a good conference call today with the University of Kansas Medical Center, and they did say at this point, with how our spread rate is going, they do believe they'll have enough ICU beds between the major tertiary care centers here and the ventilators that would be needed for Kansans. If we were to stop doing stay-at-home orders, though, and go back to what we were doing before, we would likely overwhelm the system once again, and then we wouldn't have those types of things available for people.
Sure. Now we talked about the mask. What about the other personal protection equipment? We've heard a lot of, surgeries that are not necessary, not essential, are being canceled right now. How do you feel about that?
I think that's a good idea. I think if we can minimize the number of people coming in and out of our hospitals to only those that absolutely need to be getting in there is great. We've taken great incentives in increasing the amount of telehealth that we have available as well, so that you can still talk with a physician, you can still talk with your provider without any difficulty. We're trying to minimize that foot traffic because you just never know when you're going to get a case, and the second that you get a case of somebody who has coronavirus, with how infectious it can spread rather quickly if you're not prepared for that. So by limiting the number of people that are coming in and out of a facility, that's a good idea. Limiting the amount of protective equipment that you're using to only be used in the cases for those with coronavirus is also a really good idea.
We've talked about symptoms. Let's talk about how the virus is actually spread.
So the virus is spread via droplet precaution, and so what it basically means is that whenever someone sneezes or coughs, the droplets that they produce and that come out of their mouth or their nose spread that virus through those particles that are there. Originally we were concerned that it might be caused like a semi-airborne precaution that was there. We found that that's not truly the case. It's mainly just droplet, and so the biggest thing is to make sure that when you're out and about, if you have a cough, if you have a sneeze, to make sure that you're covering your mouth, trying to direct that away from individuals, kind of pointing your head downward, doing all the good technique things that we teach everyone in common cold season anyway.
There have been, I think, over 800 negative tests performed in Kansas. Who qualifies for a test? Should you really have symptoms before you go in to try to take that test?
So I always recommend that people wait and make sure that they have symptoms before they ask for testing. Now at this point, I would say that anybody that is interested in finding out should be able to get tested and will be able to get tested as long as they contact their provider and kind of discuss what their symptoms are and they think it's reasonable to test the individual. Now anybody who's hospitalized with any of these symptoms, it's been mandated by the state health department that they be tested. And so if someone is severe and someone is likely to require further care, even intensive care, they're going to be tested for coronavirus regardless.
Okay, we're going to go to the phone lines. We've got Yvonne from Great Bend on the line. You are live on the air with Dr. Summers. Go ahead with your question.
Yes, thank you. I have pets, cats especially, and I'd like the doctor to tell me a little bit about that, if there's a risk of having my pets in the house.
Sure, that's a good question. As it stands right now, we have seen very limited spread within animals specifically when it comes to coronavirus, especially animal to human transmission. Now, there was a case in New York City recently of a tiger that tested positive for coronavirus. Again, we don't know the exact vector and how that tiger got coronavirus, but we haven't really seen any direct connection between the two of them. So it should be safe for you to enjoy your pets. You shouldn't have any problems with them picking up coronavirus and passing it to you, vice versa, those kind of things.
Excellent. Very good question. What extra precautions can be taken? She was asking about pets. What about the elderly? We hear a lot of the elderly are being affected by this. What can you, if you have to take care of someone, what can you do to help them?
So the biggest things are the things that we should all be doing in cold and flu season anyway, which is making sure that you're keeping your distance as much as possible. That 6 feet recommended by the CDC is very good. The second thing is making sure that you're washing your hands. And washing your hands specifically isn't like my kids do, where you just stick your hand in the water quickly and pull it out. That doesn't count. What you need to use is soap and water together, rubbing with friction for at least 20 seconds. Honestly, 30 seconds is probably even better. Now, there have been some people asking questions about the like the hand gels, the antibacterial gels, those things. While those are effective if they have 60% or more of alcohol in them, nothing has been shown to be more effective for the spread of the virus decreasing than just plain old soap and water. It's been by far the best. And then finally, the last thing that I'll mention is the covering your coughs, covering your sneezes if you have them, directing them away from folks, those kind of things is always important as well.
Okay, back to the phone lines we go. This is Gerard on the line from Medicine Lodge. Hi, Gerard. Go ahead with your question for Dr. Summers.
How long do you think it'll take for this virus to start to die down?
Can you repeat your question? We didn't quite get that.
How long do you think it will take for this virus to start dying down?
I think you're asking how long it would take before we notice the virus going away. I believe that's what you're asking for. How long we might be staying in the stay-at-home order. I'll try to address that as best as possible, and then maybe try to answer a few other questions with that.
Sure.
So as it's shown right now, our stay-at-home order is to last until about the end of April, as it is. Now, I foresee that we will probably extend that even longer. From the look of it, it looks like we've done a pretty good job minimizing our number of cases, but our peak as it stands right now from Kansas, according to epidemiology study, is going to be about the same time that our stay-at-home order would end, around the 19th is what it is. And we don't want to be kind of letting people out as we're hitting that peak. So I anticipate that we'll probably extend that even longer, probably until the middle of May, and then maybe beyond that time. I can't honestly see us going much past June when it comes to still keeping people in stay at home.
Okay, we're going to go back to the phone lines. We've got Paul on the line from Russell. Go ahead with your question for Dr. Summers. Paul?
Yes, I was wondering about home treatment, if you were to get the virus and the things that need to be done.
Yeah, that's an excellent question. One of the things that I'll always say is, based upon the severity of the individual, you're going to want to seek hospital care if you have certain symptoms, and those being if you're getting really short of breath and having a difficult time catching your breath, if you're coughing to the point that you can't breathe, or if you have underlying health conditions that are making your breathing worse, you probably should come in. So people who have asthma or chronic obstructive pulmonary disorder, COPD, should probably be coming into the hospital to be evaluated. Now, for the majority of individuals that are staying at home, what I'd recommend is good fluid intake, making sure that you're getting good water intake, making sure that if there's something that works for you for coughing, so whether that be like an over-the-counter cough syrup or a cough suppressant, that would be great. If you're one of the people that really benefit from like a mucus reducing medication, that would be fine to take as well. Specifically, when you look at like fever reduction in people, acetaminophen or Tylenol seems to be better at reducing fevers when it comes to the coronavirus specifically. There's some link possibly between ibuprofen and other non-steroidal anti-inflammatory drugs not doing as well with the coronavirus. Those have yet to be scientifically proven though. So what I typically tell most of my patients is Tylenol, ibuprofen to help with your fever, whichever one works better, and then whatever you use over the counter for common cold would be great for the coronavirus. It's going to work the same.
Excellent. Okay, back to the phone lines. We have Marie on the line from Hugoton. Hi, Marie. Go ahead with your question. You are live on the air. Are you still with us, Marie? Hello, Marie. Are you there? Okay.
Yes.
Oh, yep.
Here.
Okay, go ahead with your question for Dr. Summers.
Okay. My question for Dr. Summers is, do the rural hospitals have the capacity and ventilators to handle the coronavirus?
So I believe you're asking a question about ventilators and if we have enough as it stands right now in the state of Kansas. With us staying at home and us keeping these social distancing policies that we've put into place. At this time, it does appear as if we'll have enough ventilators, we'll have enough intensive care beds to handle the current flow of the coronavirus. That is all dependent upon the people at home doing what they're being asked to do by our legislator and by our public health individuals. If you're keeping your distance, if you're staying at home, if you're not an essential worker, that is really crucial to keeping the number of corona cases as low as possible. And we really do appreciate that. As a medical provider, I can't tell you enough how grateful I am to seeing all these people that are following these guidelines that we've asked. It's really made a huge difference in a number of people's lives, honestly, and I can't thank you enough for doing that.
If a person is treating at home themselves, they maybe suspect they have the virus, but they're just going to stick it out at home and try to get well there, but they're not getting better. At what point do they take a trip to the hospital?
So again, the biggest thing is with your breathing. When coronavirus gets really, really bad, it causes problems with people's breathing specifically. They get more short of breath. They start to like turn pale color. They might even turn blue in like their lips or around their lips, sometimes around their nostrils or even at the tips of their fingers. Any of those changes can sometimes prove that you're not getting enough oxygen and that you should be evaluated. The other thing too is your respiratory rate. So if you sit there and watch yourself breathing, if you're over the age of 18, you should have anywhere between about 12 to 22 breaths per minute. If you're breathing a lot faster than that, you should probably come in and be seen as well. And again, those individuals who have underlying chronic medical conditions, they should seek out help a little bit sooner if they're having concerns. So the asthma patients, chronic obstructive pulmonary disorder patients, those that have underlying heart issues should see us sooner.
We're hearing a lot about self-quarantining. How does that differ compared to just staying at home?
Yeah, so a stay-at-home order basically states that if you need to go out, you need to get supplies, if you need to go out to the grocery store, that's completely acceptable, that's completely fine. You can go do that, but then stay at home otherwise. A self-quarantine is very much directed by a medical provider or a public health servant who basically has identified you as being at high risk for having the disease currently, and you're asked to stay at home regardless. That means no traveling outside of the home. If you need supplies, if you need certain things, you're going to have to rely upon others to go get those and deliver them to you without making contact to you. And so, for example, some individuals that we've had, they've had to have family members come pick up their groceries, set it outside their home, go away, and then call and then pick that up. That's how severe a quarantine can be. You just want to be that far away. Now, can you quarantine within a home itself proper? Yeah, all the individuals within that home can stay within that same home. It's not like you have to say, well, sorry, Dad's quarantine, we got to take all the kids away. That's not what we're asking families to do. You should stay together during that time frame.
Okay, we're back to the phone lines. We've got Jean on the line from Hunter. Hello, Jean. Go ahead with your question for Dr. Summers tonight.
Yes, I've heard that you can get it through your eyes, and I was wondering a little more about that. Thank you.
Yeah, that's absolutely correct. You can receive some transmission through your eyes. Any mucous membrane that you have, so your mouth, your nose, your eyes, is susceptible to those droplets that we talked about. And so when an individual sneezes or coughs and has the virus and they're nearby you, those particles can travel and then hit your eyes. If you notice a medical provider, when they gear up to go to see somebody who has coronavirus, we put on like a respirator mask itself, and then we have a full face shield to help protect us from any kind of droplets that would come into the area. So yeah, it can absolutely pass through the eyes. It's one of those things that you have to be careful for. That's why keeping that distance is so important and is required.
All right, now when you're traveling, you're hearing a lot about if people travel from state to state, do they need to 100% be self-quarantining, and for how long?
So at this point, if anyone is traveling to an area where it's considered to be community spread, which I talked about earlier in the episode, meaning that pretty much anyone within the community going outward could easily pick up the virus, they need to quarantine afterwards for at least 14 days. Now, as it stands right now, there's a large number of states in the United States that are at the community spread level. There are also cities here within Kansas proper that are at that level. Kansas City, Wichita, both are at community spread levels as it stands. Same with most of the cities that are in Johnson County. All are at community spread. So if you do travel to those areas and you are found out or you report yourself, a public health individual will ask you to quarantine for at least 14 days after that travel.
What kind of foods can help boost your immunity when you're trying to stay well?
So the biggest thing when you're trying to stay well is to make sure that you're eating a good balanced meal. You don't want to be going out and eating anything that is like rich in fats, rich in carbohydrates. It's really important to eat just good wholesome foods to begin with. And I would say that really for any time of the year, to be honest with you. The other thing too is to keep yourself hydrated, make sure that you're drinking lots of water, make sure that you're getting the rest that you need and the sleep that you need. That's important as well.
Okay, we're on the line. We're back to the phone lines with Carlos from Minneapolis. Hi, Carlos. Go ahead with your question for Dr. Summers.
Yeah, my question is correctly turn around the air condition in the window?
Can you repeat your question, Carlos, please?
Is correctly turn around the air condition in the window?
We are not quite understanding your question.
Yeah, I'm living here in RV Park, and yeah, I got an air condition in the windows. Is correctly turn around the air condition?
I'm sorry, I don't fully understand your question. You're in an RV park and you're with a window, and you're concerned that you could get like through the windows coronavirus.
Yeah.
So coronavirus specifically is passed via droplet precaution and through droplet spread. As long as there's a barrier between you and the person who could be infected, that shouldn't spread between it. Now, the barrier has to be a solid barrier. It can't be something like a screen. So like a screen window, those kind of things, droplets can pass through those pretty easily. Keeping like a window closed would make a big difference in that regard.
Okay, excellent. Thank you so much for being our guest tonight for Doctors on Call. That was Dr. Tyrel Summers from Russell Regional Hospital. On our next Doctors on Call, we'll be discussing mental health and how the coronavirus is affecting families. You can also email questions to us for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. At Blue Cross and Blue Shield of Kansas, we're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.